This portion of the news is brought to you by Sun Oil Limited, fueling growth for people.
This year's Junior Jungle New Parade will come with some changes. The parade will be held on Saturday at the Thomas A. Robinson Stadium instead of Bay Street. Representatives from participating schools received a combined $35,000 in seed money to prepare for the upcoming parade. During a recent press conference, Culture Minister Dr. Daniel Johnson revealed that 27 schools are expected to compete come December 14th.
From grandparents, parents, some teachers. And so it is our thought, and you all should think about it and weigh in on it. But we are responsible for Junior Jungle New we are partners, and you all are partners. The end user are the children. So it's experience for them as opposed to sometimes for us.
More than 200 Bahamians from the public and private sectors and police officers flocked to a one-day health conference at the BCPOU Hall on Farrington Road on Friday. The health conference was just one way to educate Bahamians on ways to prevent non-communicable diseases and what health care is available to them. President of the Police Staff Association, Inspector Dwight Smith.
Police officers and law enforcement by extensions are very strenuous work, and we can be caught up in the day's activity of work and forgetting to actually take care of ourselves. And so we saw the need for us to more educate, and even so now we're putting more strain on because of the crime elements on officers and other agencies, but we saw a need for us to more educate our officers along with members of the public in terms of the serious health issues that we have as a Caribbean country.
Medical Director of International Medicine at the University of Miami, Dr. Lydiam Guzman, talked about the different types of medical care her medical institution offers.
We were invited to come and speak to have the Bahamians aware of health issues and what's available to them both nationally and internationally. So obviously we see a lot of Bahamian patients at the International Health Institute for the University of Miami. In fact, the #1 nationality that comes to us is from the Bahamas. We also see Bahamians who are getting their eye health taken care of at Bascom Palmer Eye Institute, which is our #1 hospital in the United States for the last 10 years, the #1 eye hospital, and we're there to serve them.
Giving the gift of blood to save a life. That's a goal of one fraternity. Members of the local chapter of Alpha Phi Alpha hosted a blood drive at Mall at Marathon on Saturday. And fraternity members took the lead by being the first to donate blood. Community Service Coordinator Xavier Sims talked about what prompted the leading Greek fraternity to fill the void to replenish supplies at Princess Margaret Hospital's blood bank.
This initiative started when we found out that the bank was low in blood. So being a community organization ourselves, we decided that we would do a blood drive to collect blood for the bank, because we all know persons that are in hospital who would need help, assistance with blood.
So we appreciate what they are doing, given voluntarily. We realize that the blood bank is urgent in need of blood, and if we could have our organization giving blood on a weekly basis, I believe that we don't have such a shortage in the blood bank, because there's life in the blood, and anything that you need to deal with people concerning health-wise, we find out from the blood.
The Bahamas Breast Cancer Initiative Foundation has been leading genetic testings exercises nationwide for about a year now, and so far they have tested some 1,600 Bahamian women at Princess Margaret Hospital's oncology department. Half of those results have been returned to the capital from a research facility in Toronto, Canada. Genetic testing counselor at the Bahamas Breast Cancer Initiative, Megan Troiter, informed our news team that genetic testing allows for Bahamian women to know their risk of breast cancer and ovarian cancer.
The data shows that if they have breast cancer, about 23% carry the gene, so 23% of the women with breast cancer, which is similar to what we thought. Of the women with ovarian cancer, half of them carry the gene, which is very, very high. And so that's something we're actually focusing on now, is the ovarian cancer risk. Of the women who don't have cancer, seems like about 3 to 5% of them carries the gene. It's probably about 5% if they have a family history, about 3% if they don't have any family history. So most of the women who don't have cancer don't carry the gene, but there is a fraction, 3 to 5% do.
And that does it for this portion of the news. Stay tuned though. Sunday Sports is next with Julian Gibson.